One, it's another day with your fertility specialist. Thank God it's Friday, and I'm excited to be with you all on this chat this afternoon. On behalf of Alps Hospitals, I love to say a very big thank you to our dear viewers. Thank you for always staying tuned. Thank you for liking our posts. Thank you for always joining our chats. So, today we'll be sharing someone's experience, success story, a story of hope. Many people that are feeling down already, to raise your spirit up, to make you know that there's still hope out there. Yeah, we have this culture of doing it most times on Fridays because we believe that it's Friday, many people would have closed from work. So for someone that is down, if you know someone that is down right now, please call up someone right now. Yes, it's Friday, so we believe most offices are closed for the day, so they have the luxury of joining, and that person would always be grateful to you for calling up or for sharing the link. So I'm using this note again to say, share this link with someone. Make sure you call up someone. If you need to send data to someone, please do that so they are able to get connected right now. We're live on all our social media handles. Please, I expect to see you all there. Today, to give a little explanation to some of the experience that this person has had with Alps Hospitals, we have Dr. Deborah Olubiyi. Dr.
Thank you,
Deborah, you're
Ruth.
welcome.
Thank you, Ruth. Always a pleasure to be here.
So
Good
for the
afternoon, viewers.
for the sake of someone watching, just in case you've not heard of Dr. Deborah is a family physician. She's an IVF specialist. She's also a fertility specialist. And least I forget, she is the head of IVF units in Alps Hospitals. Wow. Once again, you're welcome, Dr.
Thank you very
Deborah.
much. Thank you.
So, dear viewers, feel free to drop your thoughts, your comments, your questions in the comment section, and we'll definitely attend to them appropriately. As also just to draw your attention, if you also want to share your experience, if you want to share your story about your journey with fertility, please feel free to send a message to the number being displayed on the screen so that we would guide you on how you can share your life experience and try to raise a gleam of light for someone that is really downcast already. Once again, sit back and enjoy the show. Okay, so Dr. Deborah, we have a now it's like a story, but this is more
Okay.
like a life experience of a
Okay.
client that has been at your hospitals and at your hospital, and so she it goes thus. After enduring two heartbreaking failed IVF, wow, at another clinic, wow. So I was going to ask, what really makes IVF fail? Because you would just expect that since you have generated the baby, pregnancy should just happen
Happen. Yeah.
automatically. So what really makes IVF fail?
So, thank you for the question. So, IVF can fail for various reasons. So, like you mentioned, generating the baby, you
Mm,
generate the embryo. So, that embryo is made up of the egg and the sperm.
mm,
An embryo is an egg that has been fertilized by a sperm. So,
yeah.
the qualities of the embryo of the egg and the sperm will determine the quality of embryo we have. So, not just the embryo, this embryo is then placed in the lining of the womb,
Okay.
the inner lining called the endometrium, for implantation and then pregnancy
an IVF treatment before. IVF can fail. IVF fails. It's not
Mm.
automatic. The fact they've generated the embryos, the soon to be babies, it's not automatic that it will just stick. I mean, I know some people might just be wondering, but since you have put it in the womb, why will it
Yes.
not just stay? You
Stay there.
don't understand. So, but then it's so Dr. Debbie has given us a little insight too, as to why IVF can fail. You can get full details as to why IVF can fail, or also our social media handles. You could actually type and you would see some of the videos that we've done on why IVF could fail. So you can have a very good understanding of why IVF could fail sometimes. She just give us a little glimpse of what we have on that clip. Okay, so she said, after enduring two heartbreaking failed IVF cycles at another clinic, my hope was fading. That's the woman
Mm.
speaking.
Yeah.
She said, I was told I had fibroid. That's where she did the IVF,
Okay.
which was treated. She said, but her previous doctor, that's the clinic that she did before, proceeded with IVF almost immediately after the surgery.
Okay.
Okay,
After
so
a
now in the
fibroid
case of
surgery,
this
she had a
woman, yes,
fibroid
yes.
surgery.
So in the case of this woman, now they
Mm.
told her that maybe fibroid is one of the contributing factor
Factors.
to why
The
maybe the
IVF
IVF don't
failed.
succeed.
Yeah.
And then so it's automatic since the fibroid is out. We should feel that it's
That's why I said
automatic
that
that
failure, IVF failure is multifactorial. There are lots of factors that could contribute. It might be more than one factor contributing in a person. So
okay.
maybe they felt it was a fibroid. Fibroids were removed, but IVF still failed. So that means there's something else
So
they've not
after the
looked at.
surgery, is
Yes.
there well maybe as we proceed because I was going to ask that now for someone that's had a fibroid surgery,
Surgery
how soon can they proceed to have? Because she was like
almost
almost
immediately, but we don't know
immediately.
what how long that
Yeah,
almost
exactly.
immediately
So
was.
how soon for someone
Yes.
that had a fibroid
At
surgery?
least
How
for
soon can they?
yes, proceed to having an
Yes,
IVF.
or even try to
Yeah, so it
conceive.
depends on how extensive that fibroid surgery was and what the surgeon that operated thought. But averagely about 3 months, you need
Okay.
to wait for the uterus to heal properly
Hmm.
before you go on ahead with another procedure.
Oh, wow.
So usually averagely about 3 months. You want to
That's
wait for
if
about three
everything goes fine
goes
and not the
everything goes
usual
fine. There's no
complicated
complications. Exactly,
one. Hmm.
yes. You want to
Okay.
wait for at least three
Okay.
months.
So yes, for someone that has that question in mind, so she has given us, and that's why everybody is different. There are some people
Mm.
that could stay up to 6 months after a myomectomy surgery.
Yes, exactly.
It
Before
just depends on your doctor's assessment of
treatment.
you. So even if they after 3 months they are telling you the IVF can proceed, it doesn't mean that they are wrong.
Yes.
If they've assessed you that you're fit to proceed, then it
You
means you could actually proceed.
proceed.
Okay, so she said, unfortunately, that's almost immediately after the surgery. Unfortunately, it didn't work. So she said so I got referred by a friend that had done IVF. Wow, a lot of friends seem to be telling
Yeah,
their
thank
friends
God for
about
those friends that are
mm,
magnanimous enough to share,
yeah,
the light and their experience with others. Because a lot of people actually hide this information. There
vision,
are lots of people
really.
that hide the information, just come to give testimonies. I've had a baby. They don't tell people the process they went through, and they're not really helping because
Yeah, so
a lot
what's
of
your
people are
opinion
in the
about
dark.
those people that hoard? Because
No,
sometimes people do IVF and they really hoard it. Is there any
yes.
better way they need to put it? Because I don't know why they really hoard
Yeah,
this
you don't
information.
have to share the specifics of your own treatment, but you can say,
Mm,
oh, I went to so place, I had to access some help.
mm,
You could go there and see the doctor, be evaluated. You've not shared
yeah,
the specifics of your own
examination, yeah,
treatment, but they know that
exactly.
you did something extra. It wasn't a
Mm,
spontaneous pregnancy. There was something
yeah,
extra
yeah.
you did. Yes,
Mm.
you don't have to open. Yeah, people want to keep their issues private. You don't have
Exactly.
to open up
True.
everything to them. Yes, but you
Yes,
could point
yes.
them in the right direction.
Hmm.
Yes, I think that's
So
important.
and I yeah, so while you were saying this, I also just thought of people that use donor eggs and then
Mhm.
they now encourage maybe you as a woman of 45, you came and
Yes.
you used donor eggs. And then maybe your friend now comes, you've referred your friend and your friend is
Yes.
just about your age. And then you some of them might give them the wrong impression. Maybe
Yes.
you can use your egg because probably they've even
They don't
given
want them to know they've
yes.
used donor
So
eggs.
nobody is saying that you
Mm.
have to tell anybody you use donor. As a
Yes.
matter of fact, we like it if you keep it confidential.
Yeah,
But
between
then,
you and your
if
husband,
you have to
partner.
give
Yes.
someone counsel, tell them to keep an open mind. By
And
so doing, you have
listen
not
to
told
the
them this is what
but
I
you I
did.
did just be
uh
open to the
Just be
doctor's
open to the
counsel.
yes. Just be
Follow
open
what
to
the
the doctor.
doctors
If you
tell you.
follow what they tell you,
Yes,
you would
that's
hopefully succeed.
yes,
So you
yes.
don't have to now because some people get to the extreme and they now lie and say I use my
I
egg
have I
and they
have
know they didn't
I
use
have
their
a
egg.
case, I have a case someone that has used that, she's about 44, maybe
Okay.
45 now, that
Yeah.
has used that egg severally and has failed. She hasn't
Hmm.
succeeded. Pointed someone to IVF and encouraged the person that's about the same age to use her own eggs. You have
Wow.
not succeeded along that
Exactly.
line. You're telling
Yes.
someone, is
Someone
telling the
else
person
to
to
do that.
insist that she should use her own eggs too.
It's just really Jevu as well. For some of us that might have maybe access IVF either through either of the donor gametes, either egg or sperm. You don't have to tell nobody that you use
Yes.
donor egg or donor sperm. But you also shouldn't discourage other
Or
people, or
deceive
you don't
people.
deceive people and
People,
say I used
yes,
my egg or use this. You
yes,
don't have to
yes.
tell anybody about
You don't need to
okay,
give them
yes, I did
information.
IVF, fine. But you don't need to do you don't, okay, the issue is sometimes you have some very
Yeah,
endearing people
some
that will
inquisitive that
exactly
will keep
they will not ask, is it
ask
donor egg you use?
is
And
it
at that point, some people might not want to actually say, okay,
say
this is what I use. So it depends on the circumstance you find yourself. But on a norm, when you are not even asked, if you don't have to say it,
you don't have to
you can keep it to
volunteer
yourself,
that
but let them know
information.
that they should keep an open mind and
Exactly.
hope for the best, and hopefully everybody lives smiling if they get to succeed with
Yes.
whichever option that they opt for. So eventually her friend referred her to Alps. She said so when she came to Alps hospitals, the specialists took a different approach. She
Okay.
said they recommended a hysteroscopy, even though she was hesitant at first. But her decision to do the hysteroscopy changed everything.
Okay.
So I wonder why you would recommend a hysteroscopy for this woman.
Okay.
Why would you at that point when she was visiting you want to do a hysteroscopy
Endoscopy.
for
So
her?
in this case, this one has had two failed IVF. So
Okay.
failure of IVF treatment is one of the indications or reasons why we would say let's do a hysteroscopy.
Okay.
At least let's be sure that that part of the equation, the lining of the womb, is fine. Because
Okay.
I mentioned that there can be various reasons for failure, and
Hmm.
one of it is if things are not okay in the lining of the womb, the endometrium. So hysteroscopy helps you to answer that part of the question. Is the
Okay.
lining of the womb fine?
Hmm.
Is it good enough to support a pregnancy? So that helps you to answer the question. So for someone that's had a failed IVF treatment, hysteroscopy is indicated. And then
Hmm.
she also had a fibroid surgery. Anybody that's had a surgery on the womb, whether fibroid surgery is cesarean section, we also would strongly recommend that that person should have a hysteroscopy before an
Okay.
IVF treatment. There are other indications. Someone that's had multiple terminations of pregnancy or evacuations,
Hmm.
whether induced or spontaneous miscarriages,
Yeah.
and you've had evacuations or even some people dilatation and curettages
Hmm.
on the lining of the womb,
Yeah.
we recommend that they should have
Stereoscopy.
hysteroscopy. For someone that's just you've assessed, evaluated, and you've not really seen any reason why this person should be getting pregnant, because
Hmm.
hysteroscopy can also be a diagnostic tool to
Hmm.
further help you diagnose. So you want
Yes.
to check that the lining of the womb is
It's
fine.
fine.
And then it could be because of some symptoms that people are presenting with. Someone presenting with heavy periods, unusual vaginal bleeding, even
Hmm.
someone that has been having recurrent miscarriages. Hysteroscopy can be used to evaluate
To
what really
check
is
what's
happening. Yes.
happening.
So those are some of the reasons why we would recommend a hysteroscopy. Or you even do a scan and you see
Hmm.
some abnormalities in the
In the
lining of the womb.
lining.
Maybe you see a polyps, you see a growth there,
Yeah.
submucous fibroids. Hysteroscopy would help to address all these things. So
Okay.
hysteroscopy can be both diagnostic and operative. So at that same instance, as you're using it to diagnose a problem, you can also
Yeah.
operate. The
Hmm.
fibroids could
Wow.
be removed,
Hmm.
polyps can be removed,
Okay.
and even scar tissues can be removed at
Okay.
hysteroscopy. Yes,
Wow. Okay, so that explains why you at Alps Hospital recommended hysteroscopy
hysteroscopy.
for her.
Yes,
Because for someone watching, sometimes some people feel, or some people actually feel that when you medical personnel are recommending some
the
tests, you are just doing it for
for
the
the
gain, or yes,
exactly
exactly, you just want to
want
get the
to,
money
yeah,
for
exactly,
them and
just
all. But
yeah.
then, so you trust your fertility specialist to have a good reason. Nobody will just want to take you
Why
to
would you
theater.
this
I
thank
mean,
you, this is
you know.
not no about that. This is beyond the call of
Ex-
a doctor. You are taking someone to the theater for the monetary
Exactly.
gain. No, no, no,
So you
no,
see,
no.
it's not because they just want to do it for that.
Yes,
No, it's because they are also after your success. For this
yes.
person now, she has had a surgery, like the surgery I said, she has had a surgery on her womb.
Womb,
So it
yes.
means
She has had
she
failed
had a
IVF, has
reason,
failed
and she
twice.
had exactly.
Yes,
So they needed to be sure of what they are dealing with it.
it
So if they
exactly.
are seeing problems, then they know, okay, this is what we think
We
can be
need to
done.
do to
Or if
address
there are
it.
things that can be corrected right at the spot,
We
it's
correct it.
corrected. So now in her own case, she said the hysteroscopy revealed severe scarring
Can you
in
imagine?
her, she said, in my, so I'll just say in her endometrial
Endometrium
lining,
lining.
and little growths of polyp that
Okay.
had been overlooked before. So I
Okay.
think maybe they had assessed that or something, and they felt okay, it
Yeah,
wasn't.
and even sometimes the scans do not bring out all these findings as clearly.
Mm,
Yes, so sometimes the scan might even look normal or
okay.
fine, but when you go in to do a hysteroscopy, you see something entirely
Wow.
different. Yes,
Wow.
sometimes the scan could give you a guide to
Mm,
pinpoint some of these things,
mm,
but sometimes it doesn't.
wow.
Yes.
So she said the team carefully removed them and advised waiting 3 months to allow her uterus, that's more like her lining, okay,
To
she's
heal
not in the
properly.
scientific field, so she will
Yes.
just say the way she understands,
Yes, that
yes,
the whole
to heal
uterus.
properly before attempting another IVF. She said they checked again after a month. So it's more like saying, she said they called it second look
Look, yeah,
hysteroscopy.
sometimes we do,
So it
yes.
means that somebody can have hysteroscopy more than once.
Yes, you can
Because
have hysteroscopy more than once because there are some conditions that you cannot totally treat
at a
conclusively at a
sitting.
sitting. You need to come
Mm,
back and check, oh, what's the
wow.
improvement like? Is there still something to
Mm,
treat? Yes.
wow.
Because you
Because like
don't,
she said she has severe scarring.
yes. So
Hmm.
that's one of the reasons why you might need to do hysteroscopy
Second
more than
look.
once. Yes.
Wow. She said so they checked again after a month, which they called second look hysteroscopy, to be sure that the endometrium was properly prepared for the procedure.
Okay.
She said their thoroughness, that's her. Okay, she's trying to upload apps now. She said their thoroughness and patience make all the difference. So at this point, we would love to also say thank you to Alps Hospital. Yes, we've been getting quite good comments about your patients. They keep
Thank you so
saying
much.
people are so
We
patient,
appreciate our
and
clients and our patients.
oh yeah,
Thank you
so
so
the
much for the
patients
positive
thorough
review and
expertise.
feedbacks. Yeah, we
Wow.
well
So
appreciated.
okay, and then I also have Rahab Sampson. She said, "God bless you all for all you do." So she's also saying, "God
Thank you,
bless you to
Rahab.
Alps." Amen on behalf of Alps Hospital, and well done to Alps Hospital as well. And so she was like, then boom. According, that's the expression. That's the expression on her notes. She said, then boom. The next IVF cycle, that was her first IVF now in at Alps
Alps
Hospitals,
Hospital.
was a success. Wow, congratulations. So she said she
That's
couldn't
always our
believe it.
joy.
Yeah, yeah.
Success stories, positive pregnancy tests, babies.
Yeah, so she said,
Keeps us going.
I couldn't believe it when I saw those two precious heartbeats on
Oh,
the ultra
two.
scan. Oh wow. So she said, today I'm blessed with beautiful twins, and I owe it all to the expertise and dedication of the Alps IVF team. Oh wow,
Team.
IVF
Okay,
team. Oh yes,
congratulations.
we are seeing the IVF coordinator here. So you also extend our gratitude to the Alps team,
I
Dr.
will do
Debbie.
that. I'll do that.
That's this person is really, from the way I like, okay, the note is palpable. I can feel her joy even
Yeah,
as I'm
you
reading
can
the note.
imagine. It
It's
was the third
palpable.
IVF that succeeded. So
Yeah.
just a little tweak in the treatment, doing a
Mm.
hysteroscopy, just led to the difference. And that's why we counsel our clients to be open-minded. When you tell them hysteroscopy, all they hear is another surgery. But
Mm.
hysteroscopy is a minimally invasive surgery. We don't cut open your abdomen. We go through the natural orifice opening
Okay.
that God has provided. We go through the vagina. The
Oh
scope is a very
wow.
thin
Okay.
tube, goes
Mm.
through the vagina and then
Okay.
into your uterus to look at the womb, the
Mm.
lining, the inner part of the womb. So it's
Wow.
able to look at the inner part of the cervix, the inner part of
Mm.
the uterus, even at the proximal openings of your fallopian tube where it
Oh
enters
wow.
into your
Yo,
uterus.
wow.
Yes,
Mm.
hysteroscopy will look up. So it's in apps, it's a day procedure. You recover and go home after the anesthesia has worn off. You go home that same day.
Wow.
Yes.
Wow. Wow. So it's not something to be scared of, and yeah,
Yes.
it's not as difficult as you're hearing the name hysteroscopy.
Endoscopy.
Yeah. It's not as difficult as that. It's from the way Dr. Debbie has explained it, it seems like a very brief procedure,
Yes, all
a
things.
walk-in,
Yes,
walk-out procedure out of the
exactly.
hospital. So you're not worried that, okay, how we do recover. It's just maybe once in a while. I think that there might be once, maybe if there are complications,
Yes.
it maybe can be once,
Yes.
one in 1,000. That's it.
Exactly. One in 1,000.
Oh yeah. So this is okay. So okay, we're engrossed with her joy. So let me just finish up so we can talk to you, dear viewer. So she said, um now she's referring to Alps. She said they didn't just rush the process. They ensured her body was truly ready.
Indeed.
Thank you, Alps Hospitals, for making my dream of motherhood come true. Oh wow, we're so happy
Well,
for
yeah, we're
you.
really happy for her. Congratulations again,
Yeah,
madam.
congratulations. Congratulations. So it's really touching sometimes when you hear the story. And I
Yes.
can imagine if this woman decides not to take this step.
She hadn't
Like we
consented,
don't know how
yes.
long she would have had to wait.
Repeated IVF
And
failures,
then
repeated IVF failures. Even sometimes, even if even when on scan, like I said, sometimes scan doesn't show any abnormality, you know. But just to put our minds at rest that there's nothing wrong with the lining of the womb, especially for someone that's had. I said one of the indications reason is someone that's had a failed IVF, especially for
yes,
someone that's had an IVF where we thought the person should succeed, where
succeed.
we had good quality embryos, and from the monitoring that was done, the lining of the womb built up
Well,
adequately, and then pregnancy is not happening. So doing a hysteroscopy most times is usually a game changer. It's really very important that before another IVF is done, a hysteroscopy should be done so that that lining is properly, assessed. Because hysteroscopy, you're looking at it directly. You're not looking at
yes.
shadows. The scan is looking at shadows, but with hysteroscopy,
Okay.
you're looking at it directly.
Wow. So it's
Yes,
live image. So that
a
means
live
they
image.
are likely
Yes,
to be seeing what
yes. As you're
what's
going in,
being
you're
done.
seeing exactly what is in there
Wow.
directly. You're not looking at the shadows and all that.
Hmm.
So that's why it's hysteroscopy is really very important in
Wow.
IVF treatment. Yes, it's very
So
important.
yeah, so this is someone that actually had two failures.
Yes,
So I can imagine if she had given up,
that is what we
like,
tell people. Don't
and
give
not
up.
trying,
Again,
because I know that IVF is not cheap.
it's not. It's
Yes, I
not.
know IVF is not cheap. So imagine that this person. So now I'm trying to, maybe let's assume that we have someone that's failed and the person is watching. What would be your counsel to someone that's had a failed IVF, and maybe she feels like all is lost since I've tried, and maybe they told her that from the way everything looked okay, we were expecting you to be pregnant,
Yeah.
and we're not very sure. The next thing is for you to probably try again.
Again,
How do we try to make this person have the vibe
and
and
the
the courage,
confidence and
confidence to
courage
want to
to
try
try
again?
again.
Yes. So what would be your counsel to
Yeah,
such a
so
person?
one of the things I'll tell the person is that success rate for IVF increases with each attempt.
Oh
Yes, because
wow.
especially if we've done one failed IVF, we use that treatment process to even understand your body better.
Better.
Yes, no. For example, in ARPS, when IVF fails, we go back to the drawing board. We look through the treatment. We look at what could be changed, going forward when a new treatment is going to be done. So all that is done when a client fails before we now plan another treatment. So know that your fertility specialist has your utmost interest at heart, and we're not just going into this second treatment blindly. We're going with more information that
About you.
about you than we went into the first one. So the second one is more likely going to succeed, especially if you're open to the counsel that we give, open to what we think could be the issues and the way forward and solutions we prefer. If you're open to them, a lot of times, a lot of people succeed with a subsequent IVF. So
IVF.
please, let your chin be up. Know that your own day too is coming. Don't give up. That's
So
just the
for
counsel. Yes.
okay, thank you so much, Dr. Debbie. So for our dear viewers watching, yes, you've had a failed IVF. Do not feel like that IVF was like an experiment for the hospital.
Yeah.
That's not what it means. It doesn't mean the hospital did not know what they were doing when they did the first
Yes.
treatment. That's not what it means at all. But then people react to things differently.
Differently.
Exactly.
Yeah. Yeah.
So it might just be, it's just like maybe they gave you some medications and then your body might even have a counter effect. Exactly. And then there's something just changing, not following the normal rhythm as
Yeah.
expected. So in that light, maybe they are expecting something and they are not getting what they are expecting, they might say, okay, let's try something new, or
Okay,
let's
try
try
another
something
way
else.
of
That is
stimulating
not
your
to say the
ovaries.
first one that
One
was done was
was
wrong, or
yes,
it was an experiment,
or
or
couldn't
you.
lead to success. Yes,
Exactly.
yeah.
Just that now when it turns the other way, you will
You
now
now
say,
say,
okay,
okay,
you will
let's
now
try
want.
something different.
Exactly. And then you we never can tell. And there are some people that, oh, they can try all this until probably they now went go to the final extreme.
Mm.
Exactly. That's when they might now succeed. Maybe they'll say, okay, at this point we think you should use donor egg and donor sperm. Maybe there's a problem with the
Use a
egg,
surrogate.
or
They
surrogates, and
say, yeah.
also
There's
there are people
always
that
something
get
to
to
try.
extreme.
Once you're open,
Exactly.
don't give up. There's always something to try. Yeah.
So there's always a way for you to
Yes,
achieve your
yes.
motherhood dream. There's always a way. So you don't just give up at it, regardless of what it is. There's always a way. Just trust your fertility specialist to give you the right counsel, and hope for the best. Keep it positive. And a lot of times too, when they feel, they nurse a lot of fear. How do they even deal with this fear? Because it's really difficult.
Yeah, yeah. There's not a lot of fear. You even we had some pregnancy tests today, and you could see someone. I think she has failed IVF
Okay.
before,
Okay.
and today is her pregnancy test. They
Okay.
even refuse to do the test because we usually want
Hmm.
them to do the urine test at home before coming to do
Mm.
a blood test at the
Yeah.
hospital. She didn't even want to do the test. She's
Okay.
already crying. I said, Are you having any symptoms that you feel
Oh,
is not working? But just that fear from the
fear. Oh
past failure.
no.
Well, we know it's not easy, but you can also deal with that fear. You
Mm.
banish that fear. You just speak to yourself. It has succeeded and worked for other people. We just shared somebody's testimony. This was the third IVF that succeeded for this client. It can
Mm.
also work for me. Yours might not get to the third before it works. A lot of people succeed at the first attempt, but if you don't succeed, you need to just keep encouraging yourself. Nobody can talk to yourself more than yourself. You are the best person to talk
Mm.
to yourself. Encourage yourself. When there's life, there's hope. Where there's life, there's hope. You don't give up. You don't give up until you are no more. You
Yeah.
just have to keep pushing, and you speak to yourself. It will work for me. I will carry my babies too. And be open to the counsel you're giving at the hospital. I know that person's own turn to smile is coming.
Oh well,
Yeah,
yes. So for someone that's had a failed IVF,
yeah,
just in case you might be watching, your time is coming. The fact
yeah,
that it didn't happen now, like Dr. Debbie has said, it's going to happen. You just need to keep hope alive.
yeah.
You need to stay positive.
Yes,
You
very
need to stay
important.
positive. And sometimes negative vibes, some people that you're fighting everybody and you want
No, that's
IVF to
that's that's not what will bring the success. You're angry at the world, angry
mm.
at everybody. No, don't do that. Don't do
So,
that.
because I've heard that they said sometimes pregnancy come to people that seem to be happy and
Yeah, because
elated.
your body is aligning. There are lots of substances that is secreted in the body when you are happy. That also will favor the fertility journey. Yes.
Okay, so this is Asipita Adigun saying very true. That's Alps for you. Okay, so I think he or she is applauding Alps when this
Okay.
person say they are patient, they are thorough. And he said everything is true. So no lies here, dear viewers.
No lies.
You are getting first hand truth. This is someone also attesting to that what this person has said is very true. Okay, and then we have a very long list of people that have joined today, and I don't even know where to start mentioning the names from.
Yeah, we're
I
seeing all
don't.
of you. We're seeing all of you. Thank you for joining.
I see you. So I see you, Namet. Oh yeah, Namet.
Met.
Good to see you. I see you, Medugu Solomon. I see you, RJ. I see you, Charity. I see you, Dixon. I see you, Sarah. I see you, Calvin. Calvin is a regular
Okay.
follower.
Let's
Calvin,
not
thank
let's,
you
let's
for
not
joining.
spill the beans about spill the beans about Calvin. How is Madame doing and the babies?
Oh.
Oh,
Okay,
thank
I
God.
see you. I see you. I see Peter. I see you, Rahab, and I see you, Chow. Is Chow now? Please forgive me. Let me know more than your name. But there's just a long list. There's just a long list of you, and we're so excited to see your dear viewers join us today. I know you had a good time with us, and we look forward to always having a good time with you on all
Yeah,
our appearances.
yeah,
Once again, on behalf of Alps Hospitals, we love to say thank you so much, our dear viewers. Thank you for always staying tuned. Thank you for liking our posts. Thank you for sharing
Yeah.
all the time. Continue to like us, continue to share our link, continue to share our social media handles to as many people that you can share, so they are also able to get as much information you are getting. It's not just for IVF. We are here to give you all the necessary fertility care and other medical
Facility.
counsels that you need to get just to stay happy and healthy. Thank you, dear viewers, for joining. Yes, like I said before we got started, if you have your life experience and you want to share, please kindly drop a message on the number being displayed on the screen, and then they'll guide you on how you can share your life experience, just as we've been reading out other people's own, so that someone is able to get hope, just like this person is also sharing hope in the heart of someone that is watching right now. Once again, thank you, Dr. Deborah. It was
Thank you
good
for
to have you
having me.
with us
Always a
today.
pleasure to be here with you, Ruth.
Dear
Thank you
viewers,
for
I
having
know
me.
you had a good time with me today, and I also had a good time with you. Have a lovely evening. Bye.